Hey guys, so we're gonna talk about Tox for a second. And for me, I know we talked about Botox versus Xeomin.
Yeah.
I really use them interchangeably. In my world, onset, dose, duration, they're all the same.
Yeah.
So it's just kind of about which one the patient prefers.
Okay.
So what we're gonna do today is we're gonna do your forehead. And I know you've had Tox about 4 months ago.
Yeah.
But go ahead and scowl for me so we can really see that. So this muscle right in here is what we're gonna do for her 11s. So everyone's strength's a little bit different. For her, we're gonna use 20 units of Tox, and you'll see it'll be about 5 different puncture points. Really just depends on the patient's muscle. The other area we're gonna do is her forehead. So go ahead and raise your eyebrows for me. So her forehead, she doesn't have a lot of width to it, but it's pretty average as far as length. So what we're gonna do is we're gonna use 12 units there. Now her forehead's a little bit on the shorter side, so I'm actually gonna put some also in her brows just so you get that lift so you're not heavy from your Tox.
And then, thank you for that.
Right? So important. And then the last thing we're gonna do is her crow's feet. Now crow's feet to me are really tricky because you want to be able to flirt with your eyes, smile. She wants her patients to know that she's like interacting with them.
Right.
So what we're gonna do there is we're gonna use 10 units on each side.
Okay.
What that's gonna do is that's gonna give us the ability that you don't have resting lines because no one wants those.
Yeah.
But it's gonna give you the opportunity that you can still move and
Yeah.
smile and kind of talk with your eyes.
Love it. Thank
For Tox, a couple things to know after we do it. So my really only restriction is for the next 4 hours after we do it, I don't want you to lay flat on your face or get a massage or a facial. Other than that, go about your day.
Okay.
Takes Tox about a week to kick in. So I really don't like to see people back for about 10 days if there's any questions. Now, I'm super low-key, so if there's any questions about your Tox, please see me. But you wanna give it the time to settle in and also for your opposing muscles to kind of do their thing.
Okay.
So any questions before we inject?
No.
Okay, let's do it.
All right.
And then give me a big smile. Okay, and now relax. So usually for crow's feet, I'll do about 3 injection points. And that's what one side looks like. And that's our crow's feet. We use 20 units total there.
It like helps your self-confidence so much. I just feel like after it kind of settles in, like the way I look in pictures, I just feel like my face brightens up. I feel like it obviously like makes me look younger, and I mean, it stings a little bit. It's a tiny needle, but the fact that she was quick with it, I've had it like really linger before when I've had it done before, like the pain and stuff, and I've never had it done that quickly, so that was nice.
And I do inject everyone a little bit differently in their forehead. You kind of have to look at their muscles, what's stronger. Usually people have one side that's a little bit stronger than the other, and that's it. And everyone mixes their Tox a little differently. I mix mine pretty concentrated, so you'll get that little blebbing. It'll be gone by the time you get in your car. It takes about 5 minutes tops to go in.
To be honest with you, I have 2 young kids, so it had been a while since I got in Botox, so I kind of got back into getting it over the summer, but I wasn't like super thrilled with my experience. So when I met Dr. Jaime, I was like, I'd love to come and see you and see what you guys do here.